Hi, my name is Naresh Bumma, and I'm part of the multiple myeloma and amyloidosis group at The Ohio State University James Cancer Center. And I would like to talk about the LINKER-MM1 study, which is a phase 1/2 study of Regeneron 5458, now called linvoseltamab, in relapsed refractory multiple myeloma. As we have more and more agents being brought to the first line, the sphere of treating relapsed refractory multiple myeloma has become more complex and more interesting, and the emergence of bispecific T cell engager antibodies has been sort of pivotal and I believe game changing in this sphere. B cell maturation agent, or BCMA, is one of the most promising targets for treating multiple myeloma and is being targeted using antibody drug conjugates, CAR T cell, and most importantly, bispecific T cell engagers. So linvoseltamab, or Regeneron 5458, is a bispecific antibody linking BCMA with CD3 made on the Veloci vector platform by Regeneron. We had at last ASH presented the phase 1 study looking at the safety analysis for this compound, where we had enrolled patients with relapsed refractory multiple myeloma and had 5 doses that patients were dosed upon in a dose escalation pattern. The recommended dose for the phase 2 was 200 milligrams, and we'll now discuss the results from it. So this was a fairly heavily treated population. 99% of them were triple exposed, and 83% were penta exposed. 81% were triple refractory, and 37 were penta refractory. The patients had a significantly high disease of burden, with 37 of them having more than 50% plasma cell in the bone marrow and a serum BCMA median level of 0.43. So 2 doses were explored in the phase 2 cohort, 50 milligrams and 200 milligrams. Um, the safety data is actually fairly interesting. We only saw 44% of CRS, which occurred predictably with a median of 11 hours after infusion and resolved with a median of 15 hours afterwards. The median tocilizumab use was only 14% of patients. Um, Looking at ICANS, that was seen in only 5.6% of patients. Infections were seen in 54% of patients, but only 29% had grade 3 or more infections, which means severe infections that require admission to the hospital with IV antibiotics or ICU stay. Opportunistic infections, which are described as infections not usually seen in patients with multiple myeloma, for example, pneumocystis pneumonia or viral infection with a virus called CMV, was seen in about 4% of patients, and severe infections as rated at grade 3 or more were only seen in 3% of patients. The efficacy data, the overall response rate in the phase 2 cohort was 64%, with 45% being VGPR or better. In patients who were uh, accessible for MRD, MRD was seen in 60% of patients. It is interesting that some patients who are on the 50 milligram cohort had an intra-patient dose escalation to 200 milligram when they were found to be not responding. And out of the 8 patients who did undergo that, 6 patients of them had a response. So kind of to summarize, we have this cohort of highly disease burden patients with more than 37% having 50% or more plasma cell, serum BCM level 0.43, which is pretty high, and who are fairly far along in the course, with 84% of them being penta exposed, with a response rate of 64% and a very manageable toxicity profile with CRS of only 44%. So I believe that this is a very exciting data set from this specific product, and we are looking to explore this further in multiple myeloma with a newer trial called LINKER-MM2, which will be coming out looking at this compound in combination with other drugs such as daratumumab, carfilzomib, lenalidomide, and pomalidomide. Thank you.